And lower libido. There's new research about what prescription drugs can cause erectile dysfunction. Alvarado Hospital's Director of Sexual Medicine joins us live as San Diego 6 News in the Morning starts right now.
San Diego 6 News in the Morning. Your station for balanced news.
How men can lose their sex drive due to cholesterol medication. Alvarado Hospital's Director of Sexual Medicine joins us next. Stay with us.
And Courtney, we have this health alert. Cholesterol-lowering drugs can cause low libido in men and even erectile dysfunction. That's the new finding from a study published right here in the Journal of Sexual Medicine. The editor-in-chief of that journal, Dr. Irwin Goldstein, joins us live to talk about it. He's also the Director of Sexual Medicine at Alvarado Hospital. So you know sex. That's your thing. Thanks so much for being here. All right. And the cholesterol medication is something that so many people use.
So 1 in 6 people in the U.S. have low cholesterol, and 30 million people use cholesterol-lowering drugs.
And so what's going on exactly?
Well, it turns out that cholesterol-lowering drugs act to stop the messages from the brain that activate the genitals, which would be the testicles here, to make testosterone. So there's a lower testosterone in these users of this product.
And you said this is something you've seen a lot just anecdotally, right?
Well, we have many patients coming in with sexual problems, and the odd person would say, gee, ever since I started my statin drug, things have changed. I don't know what's going on.
And so how bad is it, though? I mean, is it a real big difference?
Well, it's 2 times the numbers of users, statin users will have 2 times the number of low testosterone than non-users, so it is a big problem. There's 30 million users. But the issue is, if you're having the symptoms of low testosterone, which would be tired, weakness, athletic performance off, sexual issues off, you're depressed, sad, blue, grumpy, that kind of stuff, just get a blood test. It's really quite simple.
And then there are some solutions to this. This is not an incurable problem.
Right. So stay on the drug. The drug is important. It stops cardiac problems. It lowers cholesterol. Mortality is less on this drug. But you might as well have a quality of life. So if your testosterone is low because of the drug, there are 3 FDA-approved treatments. There's topical treatments, there's injection treatments, and there's subcutaneous pellet injections, all FDA-approved and easy to use.
Any of those work better than other ones?
They all deal with the issue. It's really a convenience issue for patients, really.
Most people choose the rubs because they don't have to get the injections?
Well, the rubs have transfer issues. It's an active drug, and you don't want to spread it to other people. So that's the issue against the gels, but the gels are useful. The injections are financially easy. You just poke it into your thigh, really, once a week. The pellets are the most convenient because they last for 4 to 6 months.
Some people might think when they think of low libido or sexual problems, erectile dysfunction, they think about Viagra. You said not here.
No, so this is, well, Viagra deals with erections,
right.
And testosterone deals with erections, but this is about the hormone. This is a drug that lowers cholesterol that, for whatever reason, lowers testosterone. It's an important health message to patients. You shouldn't have low testosterone.
Right. So there was, obviously you're dealing with testosterone, but did these drugs have any effect on women's sexual urges or anything like that?
Well, women take statins.
Right.
The data on the publication in the journal is about men, but I'm seeing women on statins with low testosterone. So I'm sure when studies get around to studying this, they will show the same.
And what are the issues for women that are having low libido? What should they do?
It's actually quite the same. And for women, although estrogen is thought to be the only hormone, testosterone is as important as estrogen in both genders, really.
Really?
And specifically in women. So it's athletic performance, it's depression, it's sadness, blueness, it's lack of drive, athletic performance off. Those similar things are seen in both men and women.
Okay. And last question. Yeah, you run the Institute of Sexual Medicine. What's that like? How do you get that job?
Oh, it's awesome. It's awesome. We're really the only one in the United States to have departmental status at a hospital, and we deal with men and women with sexual health problems, and we help so many people. It's really great.
Yeah, which can be such a big, life-changing thing. Well, thank you so much for being here.
Thank you so much. I appreciate it.
And again, the Journal of Sexual Medicine is what he's the editor-in-chief of. This is out every month, and the article's right here inside. For more information on all this, you can go to san diego6.com and click on our link, Hot Topics.